Hi everyone, thanks for joining us this evening. I'm Jodie, I'm one of the Field Human Resource Recruitment Officers here at MSF Australia, and I'm joined tonight by Dr. Andrew Dimitri, an experienced MSF field worker who's completed 13 placements. Hi Andrew.
Hi, how you going, Jodie?
Before we begin, I'd like to acknowledge the Gadigal people of the Eora Nation as the traditional custodians of the lands upon which we meet today, and pay my respects to the elders, past, present and future, for they hold the memories, traditions, culture and hope of Aboriginal and Torres Strait Islander peoples of Australia. In recognition that MSF Australia is a binational association, I take this opportunity to acknowledge Maori as Te Tanga Whenua and the Treaty of Waitangi Partners in Aotearoa, New Zealand. The webinar tonight is for people interested to work with MSF in the field. We'll cover MSF roles and recruitment information, and we'll hear firsthand about life in the field. We'll also have live question and answer session at the end, so please send through any questions on YouTube, Twitter or Facebook, and we'll save them till the end to answer. With more than 47,000 full-time equivalent staff across the globe, the majority of MSF staff are local hires. International field workers manage and lead teams of people, and these profiles are split into three categories: medical profiles, paramedical profiles, and non-medical profiles. We welcome applications from profiles at any time of the year. However, at present, we have some high need profiles. In the medical profiles, we require obstetrician and gynecologists, anaesthetists and surgeons. We require paediatricians, infectious disease specialists and psychiatrists, as well as paediatric and neonatal nurses. We also have a need for pharmacists, experienced epidemiologists and medical science in the paramedical fields. For the high need non-medical profiles, we need HR managers, finance managers and logisticians. One of our essential recruitment criteria is a willingness to work in unstable environments. The reason for this is that over 25% of our projects exist in armed conflict situations such as Afghanistan, Iraq, Yemen, and 26% of our projects exist in locations with internal instability such as South Sudan. We'll get straight on with the best part of the evening. Andy, can you share with us what led you to apply with MSF?
Thanks, Jodie. My parents are from a Coptic Egyptian background, so they grew up in Cairo in Egypt. They grew up very poor, from an ethnic minority. And they had a really tough life when they were growing up. They grew up in really difficult circumstances, and they really struggled for everything, just struggled to get an education and to have food on the table. I was born in England and raised in Australia, and I had a really comfortable life. I was, definitely a beneficiary of having a stable political system, having a loving family, an excellent public education. I felt I had so much that was given to me. So I really wanted to do medicine initially in the first place as from a kind of a sense of social responsibility. And that's why I joined MSF, to try and give back something to back to the community and back to less privileged people in the world who didn't have all of the advantages that I had growing up.
Yeah, great. Thanks, Andy. Can you tell us a little bit about day-to-day life in a project?
So look, Jodie, it really depends on the kind of project there is. I mean, the projects vary so much, and some of the projects have like large numbers of people, some of them have small numbers of people. Some of them are centered around, say, one specific project, so there might be like a big hospital, for example. Others, you might have clinics dotted through the desert or through, like the bush. And so, usually it is very busy. Often in the projects you work 6 or 7 days a week. Sometimes in a less busy project it'll be 5 days a week, but mostly it's 6 or 7, and the hours are long. You often are living with large numbers of people in like an MSF guest house, and work is like usually starts early in the day and does often finish late in the evening. But that work might be working in a hospital or You might be in a non-medical profile and you might be, say, for example, involved in construction of so water tanks or a hospital in a refugee camp. You might be driving through the desert to a remote clinic to set up a clinic to do malnutrition screening for children. So it really does vary, and it's not the same in any project.
Thanks. Can you tell us one of the projects where you felt was one of the biggest challenges professionally?
So I mean, look, every project comes with its own challenges, and the challenges are always things you can't expect. But certainly in 2014, during the South Sudanese civil conflict, we were working in a refugee context where there was a big movement of people away from the conflict zone. The South Sudanese people were walking about 2 weeks to get to where the refugee camp was. And when I got there, we had a relatively small hospital that was 30 beds and a refugee camp that was maybe 10,000 people. And within the first kind of 6 weeks of me being there, the refugee camp had swelled to maybe 100,000 people. And our project initially went from 30 beds to 60 beds to 90 beds to 130 beds. And we had a big intensive care unit and a 60-bed malnutrition unit. This was in the middle of the wet season. It was malaria season. And so many of the kids were malnourished from the 2-week journey, because it doesn't take much for a child under the age of 5 to become malnourished. So we had lots of very sick, malnourished children. We were the only secondary referral hospital for the refugee camp. So there were the primary healthcare clinics in the camp, but MSF was running the only hospital that was able to hospitalise people and give them kind of more intensive therapies. So it was really, really difficult. We had lots and lots of sick kids. We were under a lot of pressure, and it was difficult circumstances. It was raining, it was wet, there was mosquitoes everywhere, it was muddy. The river next door was, because, going up, and eventually at one point did flood the hospital shortly after I left. No one was hurt, but the hospital had to be moved. So it was difficult circumstances, working in tents, but it was incredibly rewarding. Worked with incredible people from the local community and also international staff, and we saved a lot of lives. So I think that's probably one thing that sticks out in my mind.
Yeah, thanks, Andy. It sounds very complex and really incredibly challenging. How do you prepare yourself for these sorts of missions?
So look, I'm not sure if there's anything specific that you can do to prepare yourself. You never really know what to expect on a mission, and missions are changing all the time, and the challenges that you face are never really quite what you expect them to be. And it really depends on your profile. I think professionally, if you get selected to work for MSF, then you have the qualifications that they need. And MSF does provide training for things that might be gaps in your qualifications. But in terms of, psychologically, how do you prepare? Well, I don't know. I think it is actually really difficult. And I don't think that you really can know what you're in for until you're kind of there and experiencing it.
Yeah, thanks. You mentioned that you're living with your colleagues, and I guess with MSF, it's as an international field worker, you're living and working somewhere. What are the sorts of challenges and rewards in living in a compound or in an MSF project?
So yeah, one of the things that's important to realise is that when you work in an MSF project, you will be living with other field workers, and you will all be living together and in pretty close quarters for long periods of time, and working together all day. So in most of my projects I've done in the last decade, I've been sharing a room with someone, and you might be sharing that room with that person for months, and you get to know them pretty well, sometimes too well. But no, it's always really rewarding. You're working with people, and you're living in close quarters. What that does is it provides really close bonds with people. So you have to be flexible enough and compromising enough to realize that people coming from vastly different cultures, from different walks of life, they're different ages, will all have different approaches and different requirements, and everyone's under stress because we work in inherently stressful situations. Sometimes and I've worked in many conflict zones which are high security areas where there is a lot of danger, and so during the day, people are working in stressful situations where if you're medical, you might be working with sick patients, but if you're non-medical, you might be trying to build a hospital in a really complex and dangerous and tricky situation. And then you come home and you're kind of often with the same people, exhausted and tired, but it's incredibly rewarding. You make really strong and close bonds with the people that you work with. And some of my most valuable experiences with MSF have been those bonds that I've made with staff from the country we're working with, and we call them national staff, and also with expatriate staff who've come from other countries.
Yeah. Thanks, Andy. And so how do you de-stress? What do you do in your downtime, you personally, to manage that stressful situation, both living and working stress?
So look, in MSF missions, it's not just all about work, work, work. Certainly work dominates, and if it's a really complex situation like a conflict zone or a refugee movement, you might be working, a huge number of hours. But there's also a lot of downtime, and in the downtime, you do a lot of really rewarding and fun things. You might have dinners with the team, you might be able to go to some of the local areas or some of the local villages, although that's often not possible in a high security context. You play sports and games, table tennis, Uno cards, and all of that stuff is really rewarding. So you do get downtime, which means that the whole experience, it's not just about stress and exhaustion, but you also it can also be fun in its own way.
Great, thanks, Andy. And can you tell me, you mentioned the complexity of a high security setting. Can you tell me what's been your most challenging project in regards to security and the risks involved?
Yeah, look, it's a tough question, and I've worked in a lot of high security contexts, like in Yemen and in Somalia and in Iraq and in Ukraine. One thing that does stick out for me is working in Somalia in 2013, which is just at the end of their civil conflict, and the militant groups still controlled the majority of the country, and it was just a small area of Mogadishu that was considered safe. And in that context, we were not allowed outside. We basically were allowed to go to the hospital and to home. We were not allowed outside at all for 6 months. We had a relatively small team. There was only 5 of us, 5 expatriate staff, but we had a very large and really amazing Somali team, of maybe more than 100 staff. And we had, we had so much to do with both the expatriate and the national staff. But in that circumstance, we would travel in a different car. Every few days we would change our car because it was a high kidnapping risk area. So we would change our car so we had an unrecognisable car. We'd use a different route every few days. We would leave at random times in the morning and come back at random times in the afternoon. So we would never be in a predictable routine. And look, in MSF's history, since it began in the 70s, it's never had, and its philosophy is not to have armed guards, even in very dangerous areas. And that's because MSF believes, and I totally agree with this after more than a decade in the field, that armed guards make you less safe, not more safe. And the MSF is amazing at negotiating the safety of its staff through talking to the local actors, and they might be state actors or non-state actors. But in this particular case in Somalia was the only situation in which MSF has had armed guards. And we did have armed guards for the period of my stay there. So again, that was also stressful as well. So, I mean, that's probably the one that sticks out in my mind the most.
Yeah, thanks, Andy. I think that's really sobering for everybody to hear that we do operate in high-risk environments, and it is something that as a potential field worker you need to consider. So thanks very much. So after 10 years of placements, how do you manage effectively returning to Australia each time and reintegrating back into your life here?
Look, it's a good question, and I think it does get easier and easier with time. And it also depends on how long you go away for. So if you're going away for longer periods, which I certainly did earlier in my MSF career, it's kind of it's harder to readjust. And if you go away for shorter periods, it is easier. MSF is really conscious of and supportive of the mental health of its field workers, and is really aware that working in the field is extremely stressful. So they provide a full psychological package when you come back of psychological help that is paid for, psychological help if you want it, professional people that you can see, and it's paid for by MSF. There's also a peer support network where you'll get a call from an experienced MSF field worker when you get back, just asking if you want to debrief and download. And that is outside the MSF hierarchy. So, you can have a vent about anything about the mission that was upsetting or frustrating for you. Also, there are a series of debriefings, official ones, in the Sydney office and often in an office overseas as well, depending on the project. But, also part of it is about having good friends and family, having people to listen to your stories when you come home. And sometimes you do feel that no one really does understand what you've been through, and that is when it can be particularly difficult. But overall, I think MSF is really conscious of this, and they do make a big effort to make sure that people are psychologically well adjusted when they return.
Yeah, thanks very much. And mentioning the association, which are obviously returned MSF field workers, and is a great resource for that support. Yes, yeah. Thanks, Andy. And so, just as a last question before we go into a couple of other points around the recruitment process, what would you What would you say was the most rewarding aspect of your time with MSF to date? I don't know if there's one thing.
That's a big question. God. I mean, look, I couldn't say one thing that's the most rewarding aspect of my time. I mean, working in really kind of complex and challenging regions of the world and feeling like you're contributing to something you really believe in, making a difference, is obviously why we all do it. Seeing the amazing patients that we work with, some people who have been through unimaginable and horrific trauma, but be so resilient and so kind and so open and so loving and so accepting, even though you've had family members die or lost limbs or been through terrible injury, is really, it's actually just giving me goosebumps talking about it, but it's really something that you take away with you for the rest of your life. And then also you just meet incredible people working in really difficult situations. You make really strong bonds with people. We work with incredible staff from the countries. Most of the work is done by the people in the country that we work in. Okay, so the field work is from external countries, be they a Western country or low income or a high income country. We're only a small part of the workforce. Most of the workforce, by far, most of the hard work is done by the people from that country, and making strong bonds and ties with those national staff members, but also other expatriate field workers is, you know, I mean, I've got MSF friends now who are dotted all over the world, and that's really incredible as well.
Yeah, thank you very much, Andy. Well, if that all sounds very interesting to you, you can learn much more on the MSF Australia website. There are general criteria you need to meet for every applicant, regardless of the role. So alongside each MSF role, we also have specific criteria, and these again are outlined on the website. All applications must be made directly through the MSF Australia website. Once you complete an application, you'll be technically assessed, and if you're validated, you'll be invited for an interview. This interview goes for about an hour and a half, and if you're successful in your interview, there's a few other recruitment procedures, including reference checks and pre-departure training. If you're successful through all the recruitment processes, then you'll be approved and ready to mobilise for the field. In the current global pandemic, MSF's managing significantly more logistics to get staff mobilised. With the travel restrictions, it's very difficult for us to say when you would be matched and mobilised. This can be discussed further with you should you complete an application and be successfully recruited. Finally, before we go to questions, I'll touch briefly on the contract terms. This information is also on the website. So if you're successfully employed with MSF, you'll be placed on an Australian fixed-term contract under Australian employment laws. $3,211 per month is your starting salary for all field workers. MSF does have a salary framework as you progress through your career with us following the first 12 months. You receive 25 days annual leave pro rata, and some of the benefits include flights, accommodation, meals. As Andy mentioned, psychosocial support before, during and after your placement, as well as insurance. So that's it for the formal side. I see there's quite a few questions that have come through. Thanks, Maddie. Are people who have previously served in the Australian Defence able to work with MSF? As a general rule, you need to have been a civilian for at least 2 years before you make your application, and you cannot be on the reserve list when you apply. And there's a question from Chloe around how long does the recruitment process take? Thanks, Chloe, for your question. Recruitment can take, from when you submitted your application, between 6 to 8 weeks for a response, and then invitation to interview. Recruitment, reference checks and pre-departure training can take 3 to 4 months. What was the recruitment time frame like for you, Andy? You remember
so it was
that?
a while ago. So, I mean, I remember I went through a process that probably took, a month or two. I mean, I sent in my CV, so my application, and then they got back to me and they did an interview. And then I was accepted. And then we waited for the next welcome days, which is the kind of, orientation process. But then I was off like the next day. So, yeah, that all kind of organised a mission for me already. Yeah.
Right. And so, as you see, after the pre-departure training, Andy was mobilised straight away. Sometimes people can wait up to 6 months after pre-departure training. It depends. And at the moment, with the pandemic, it's very difficult for us to say when you would be mobilised after you've been approved. So even though you're approved for the field and you're successfully through the recruitment process, you wouldn't be leaving your job until you're actually offered a placement or mission somewhere. Claire said, are there many opportunities for social workers? MSF does take social workers. We do recruit social workers and we do need mental health profiles at present, but you must have at least a few years of clinical work and obviously each person will be assessed on their qualifications and skills and experience. It's a question around, can you take partners? Andy, do you want to?
You can't take partners into the field. I mean, with MSF, you tend to work in very, very complex areas, often high security areas where it's difficult even getting MSF staff into the field. And, you know, staying in an MSF house with just other MSF workers and you're all, and already, you know, you're often sharing rooms and there isn't enough space. So there's really no opportunities to take partners on MSF missions, unfortunately.
Thanks. Another question around what advice would you be around what to pack, Andy?
Oh, that's a good question. So I actually have a list on my phone. So sometimes I get a call these days. I kind of do mostly emergency. Well, my whole career with MSF has been mostly emergency missions. And so we'll be responding to emergencies and I might get a call and they might ask me sometimes to leave the next day. And so I actually have a list on my phone these days, which is everything I might need for any MSF mission, including if it's the middle of winter in Ukraine when it's snowing or the middle of summer in the Ethiopian desert where it's like 45 degrees. So it's kind of like this pack of, you know, clothes can kind of last me, can work for me in any situation. So you kind of have to, you do get really good at that. I think the first couple of missions you always forget something really important. I think a Bluetooth speaker is really, really important for most missions though. You'll miss it if you don't have it.
Thank you. Oh, another one for you about what's the most rewarding thing or what you've experienced in the field?
I mean, it's a very difficult question because there's so many rewarding aspects to MSF, but I would say as a doctor and, you know, a frontline healthcare worker, I think working with, you know, patients who have suffered a lot of trauma, whether that's psychological or physical trauma from conflict zones has been something that's been really humbling and really life-changing for me to have worked with patients like that who have been acutely unwell and who have been through so much pain and suffering. It really reminds us of how lucky we are to have been raised and to live in countries where there's safety and where you can be guaranteed your safety and some sort of protection by the authorities. So many people in the world don't have that, something we really take for granted. So I think that having the privilege to work with those people in those circumstances has probably been one of the most rewarding things.
Thanks, Andy. We've got another question from Matthew. I'm a WASH specialist. Can I be of importance in this emergency context? Do you want to talk to the non-medical profiles?
Oh, yeah, look, I've got a lot to say about that. So, look, I think it's really important to realise here, MSF is, healthcare workers are only about 50% of the staff with MSF, and doctors in particular. It's called Doctors Without Borders, but doctors are way less than 50% of the staff are actually recruited for MSF. I would not be able to, and doctors in the field and nurses and other healthcare providers would not be able to do their job without this massive team of people who make these projects possible. I mean, they're logisticians, construction experts, water and sanitation, hygiene experts, admin experts, HR, human resources experts. I mean, there's so much that goes in to getting, say, a field hospital set up in a refugee camp in the middle of the desert, 4 or 5 hours on a rough road from the closest town. If you can imagine the logistics that just go into that and getting the drugs there and getting the vaccines there at the right temperature and, you know, getting the hospital set up and getting water and water points set up. I mean, it's just really breathtaking and it would be impossible to do medical work without all that support. So getting specifically to water sanitation and hygiene, I've worked with a number of WASH, we call that WASH in the humanitarian world. I worked with a number of WASH specialists with MSF over the years, and their work what they do is really incredible. I've seen them dig for wells on the South Sudanese-Ethiopian border. I've seen them create waste areas to get dispose of biological waste in really remote zones. So it's really incredibly crucial. It's something that MSF does quite a lot of. They provide training for it. They look for experts in it. And it's really part of our core, in some ways part of our core business. So, you know, every hospital needs access to clean water, it needs a waste area, but often refugee populations themselves need access to large amounts of clean water. And whilst a lot of other NGOs do that as well, that is something that MSF does. So absolutely.
Thanks, Andrew. Edward has asked, what's the average time frame for a mission generally? And all first missioners need to be available for 12 months, except for obstetricians, anaesthetists and surgeons. The placement may only be 9 months, but you need to be available for 12. And then, as Andy said, once you're an experienced field worker, you're able to change the commitment that you make.
Yeah, so once, I mean, in the beginning, the periods have to be long, and that's for a variety of reasons. You know, a lot of it is also about gaining the skills that are required to make yourself really useful for MSF. As you become more experienced, you do have an opportunity to do shorter missions, but that really depends on the specific need and what your profile is. In an emergency context, the missions might only be 1 or 2 months, or 3 months. And, you know, I've done some assessments where, you know, I did an assessment last year of a countrywide assessment for Cambodia where we were assessing for the extent of the dengue fever problem there and whether MSF needed to make an intervention. I was in Cambodia for only 2 weeks. But in general, in the beginning, you have to understand it's a really big commitment and it's at least a year that you need to put aside.
Yeah, and I guess as an experienced field worker, you're able to go in and
operate
straight away within the MSF.
Yeah, I think when you're an experienced field worker, but we're talking this is years down the line, it's a relatively small number of people. There are other opportunities that come up, but you need to understand that for the first few years, most of the commitments MSF will ask you for, even though the first one might be a year, after that they'll often be asking you for at least 6 months. Yeah.
So first mission, 12 months.
First mission, we have to have 12 months open. Right.
Meredith said, is there a role for primary care GPs in MSF?
So absolutely. By far the majority of doctors who work for MSF are GPs. I would probably say 80% of them, maybe 70 or 80%. There's also lots of emergency physicians, paediatricians, and then there's surgeons and anaesthetists. But it's important to realise most of the medical work that MSF does is actually medical rather than surgical work. So surgical projects are actually relatively small in number, and trauma projects, which is what kind of everyone expects MSF to be doing all the time, are actually very small in number. The majority of the medicine that MSF provides is our medical emergencies. So often they're children with malnutrition, malaria, pneumonia, and diarrhea and dehydration. So we do a lot of paediatric projects and a lot of medical emergency medicine. So GPs are really well suited to that. We do a lot of outpatient stuff as well. And like I said, the majority of the people who work for MSF are actually GPs, the majority of the doctors.
All right, well, I think there might be some more questions, but that we've come to the end of our time. So we will continue to answer some questions online now and also tomorrow when we're back in the office. But before I say goodnight, I'd just like to say thanks very much, Andy, for sharing your experiences. And we look forward to hearing from you after your next placement.
Great. Thank you very much, Jodie.
Thank you. Thank you, everybody. We look forward to